Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. Talk about starting something. That's exactly what Geetinder Goyal is doing with his practice, his healthcare practice, medical practice, Our Way Health. That's OurWayHealth.com. He's making what is called high-end concierge healthcare services available to everybody, essentially everybody. This is extremely affordable. And I, for one, am excited because it's part of a larger revolution to restore the integrity between the relationship between doctor and patients that I think has been ruined between insurance companies and the government. Dr. Goyal, as always, glad to have you on the show.
Good morning, Kevin. Good morning, everyone. Nice to be back.
Talk about what you're involved in, what you're doing.
What we are doing, Kevin, is like you said, basically restoring the sanctity of the doctor-patient relationship, which over the years has been eroded away because of heavy insurance and government regulation, I feel like. And we're basically trying to restore that. And it's for me and for my organization, it has become now a process of educating ourselves as well as our patient population. And what we are trying to do for them is help them manage their health as well as their healthcare dollars in the best way possible.
Yep, absolutely. No question about it. Now, was it this week or I think it was last week, we had a great conversation with the folks at the Free Market Healthcare Association. Talk a little bit about what they do.
So Free Market Medical Association, or free market in general in medicine, is a movement that what they are doing is, as they will describe it, that they're bringing buyers and sellers of healthcare together. What is happening in our country is that as buyers, as consumers of healthcare, we have no idea of the prices that we are paying for healthcare. We are paying tons of money to insurance companies, to Medicare, but the value that we are getting out of that is very low. And a lot of that is because of distortion of the prices and fixing of the prices. Free market basically puts healthcare in the same category as any other business. For some reason, we have treated healthcare as a separate, different entity, and we've given healthcare a special status. People, however, need to realize healthcare, the way we buy, we purchase, we use healthcare is like any other commodity, basically, for the most part. And so there needs to be a healthy free market alongside the insurance market for our consumers to get smarter, as well as bring price transparency back. Price transparency is what is going to improve the quality as well as lower the prices of how we buy healthcare. And I'll give you a quick example, Kevin. Like one of my members, and we are seeing members in our clinic. We call them members, not necessarily patients, but we have about 30 members. We are, 6 weeks old after we open, and one of our members needed an MRI of the brain for a hearing loss problem. He has Blue Cross Blue Shield, and the price code he got from the Blue Cross for an MRI was $4,200, and his deductible is $4,000, so he had to pay $4,000 out of his pocket. We got him on time. We stopped it. We price shopped, and we got the MRI done for $275. Almost $4,000 in savings just because we were a smart consumer. We helped our member be a smart consumer and saved him thousands of dollars right there. That's what I mean by price transparency and educating our consumer. It's going to drive our cost down.
Yeah, no question about it. And, the reality is if you add layers to the cost of anything, it's going to be more expensive. If you take away layers, it's going to have the same effect. It's going to become less expensive. And
exactly.
That's exactly what free market healthcare does, correct?
Absolutely.
Talk a little bit.
We need a healthy free market where the buyers, which is the providers of healthcare, like doctors, nurses, physician assistants, nurse practitioners, they can bring the product directly to the consumers without any layers, remove the layers like you just said.
Yeah, absolutely. So how many of these events have you attended? We're talking about going in August, and I'm looking forward to that. How many of events of these have you attended?
So I went last year. I learned about this organization last year, what they are doing. Dr. Keith Smith, who runs Surgical Center of Oklahoma, which is totally a cash-based, price transparent surgical center. Him and Jay Kempton, the Kempton Group CEO, they founded this group about 3 years ago. The membership has grown to about 300 members, a lot of interest. A lot of very good speakers who really bring to the forefront what is really plaguing our healthcare system. The exciting part for me was that I met a lot of physicians there that are really now getting the concept that, look, we are the product. We don't need to have these networks that basically distort and confuse the consumer. Free market brings simplicity back to healthcare. Mm-hmm. And that's what these guys are doing. And the event this year is going to be even bigger, I feel like, in August 18 to 20. Highly recommend that everybody, business owners especially, should attend it.
Yeah, did business owners attend the one you went to last year?
Absolutely. Absolutely. A lot of business owners there and a lot of self-insured employers there. Because now the self-insured employers who control their dollar are always looking at their bottom line, how much they are spending healthcare dollars-wise. They are learning about the free market, the movement, what that does to their bottom line, how it improves quality, how they know what they're going to pay for any service they buy. Quick example, total knee replacement. For example, your employee needs a total knee replacement. Why is it that it can cost, $30,000 in one hospital and $60,000 in another hospital? It's just crazy.
Yeah, it doesn't make sense. Yeah, it doesn't make sense. It's and that just goes down to this kind of almost like insurance has kind of made us like sheep in a way when it comes to our healthcare decisions, hasn't it?
Yes, absolutely. When self-insured employers see, look, the total actual price of getting care is much less. So they can buy a total knee replacement at a quality hospital for about $18,000. Mm-hmm. And they know what they are getting beforehand, so they can plan, budget. So that's huge savings. And they have data. FMMA has data now how they have saved millions of dollars for self-insured employers by moving them towards buying healthcare through the free market way, directly from the sellers, directly from the providers of care, instead of involving layers and layers of insurance and regulations in between them.
Yeah, it's very interesting, very interesting. OurWayHealth.com. When you found the folks there, had you already realized that they needed to do things differently and it was kind of a eureka moment that there was another group that was agreeing with you, or did they kind of bring you to the conclusion that, things needed to be different? Tell us about how that evolved.
That's a good question. Kevin, for me, it has been a process. What I tell people is, look, medical school teaches you about medicine, but it teaches you nothing about how the business of medicine works, how the insurance works. And I started learning that once I had finished my training. And I really wanted to understand, what I am getting into. So I've gone through a process of understanding and figuring out what really is the right thing to do that benefits everybody in the system. And during my process of, learning, soul searching, I learned about FMMA, met the leadership, met the other people who were part of it, and, you gain clarity. So they have definitely helped me in the process of reaching where I am right now.
Well, I'm looking forward to you and I going there in August. We need to strategize on how we can have the biggest effect when we go, because I think this is a very important thing.
I totally agree with you. I think we are going to have a lot of fun. We're going to meet a lot of people who are going to be critical in getting us out of the mess that we are in right now in healthcare.
Yeah, I agree with that. And looking forward to resuming our interviews. This is a great interview today, by the way. I really enjoyed it, but also resuming our interviews with others that are also pioneering what we're doing.
Definitely. Looking forward to it.
All right, my friend, Dr. Geetinder Goyal, Geetinder Goyal, MD. He's at OurWayHealth.com. If you're tired of being treated like cattle, and if you want to be treated like a human being in the way you're dealt with in your health care, and then in a way that's financially responsible, you need to know Dr. Goyal. All right, when we come back, much more for you. I do want to remind you, best content here shows up over there at USDailyReview.com, and this is The Price of Business.